Thank you.
Jorge J-O-R-D-E.
Thank you, Ben. Making a difference to me. So we're about to get started. I got another one being made. Just if you want to stand off to the side. So, welcome everybody. Does anybody need a few more minutes, or are you guys okay? Okay? Sorry, I knew we had a latecomer over here. I'm going to get started with some introductions here, and just let me know if you're still having equipment issues. Okay. All right. Great. So, wow, it's been almost a year since we saw a bunch of cameras in front of us. We've been doing this with GoToWebinar, and so this is a little bit different. Thank you for being here today. I appreciate it. My name's Fields Mosley. I'm the Communications Director for Maricopa County, and we've been in a unified command structure now for almost a year, and you've heard from us many, many times. Thank you so much to the media for joining us today. Thank you for those of us who are joining us live on Facebook and live on YouTube as well. We hope to get a lot of your questions answered today. And we have a lot of people to talk, but we'll, Executive Director of the Maricopa County Department of Public Health, Marcy Flanagan, is going to be saying a few words, kind of outlining some of the things that have been going on in our community and the planning. Of course, a big announcement from the state yesterday from the VAPAC committee, of which Director Flanagan is a member, and then and she can talk a little bit more about that. But that, it gives us a little more clarity of what vaccination distribution is going to be like going forward. I also have Dr. Rebecca Sonnenschein. She is our Medical Director for Disease Control at the Department of Public Health, and she's here to answer questions if you have those today. And I also have Jorge Mendoza Yescas. He is the Consul General for Mexico, and a very important person to join us today and talk a little bit, especially for those members of our community who may have doubts about the vaccine, may need to understand a little bit more about what's going on in the Spanish-speaking community. So he's here to address those questions and say a few words at the very beginning as well. So I also have Dr. Cecilia Rosales. She is an Associate Dean at the University of Arizona. She is here for questions as well. University of Arizona is our partner at this particular pop-up event, serving the seniors who live in this public housing. So she can talk a little bit about the operations that they go through, the people they've been serving, and more on that if you have a question about that at the end. So a couple of little things too. You're welcome to get video of this event. If you see a resident, however, wearing a sticker like this, please don't shoot them or show their face or anything like that. They've requested not to be photographed. So we appreciate that. And we also have a few residents who are willing to do interviews afterward as well to help you tell your stories. And I believe in both, Joanna, correct me, Spanish and English? in Spanish and English. So if you're doing a story specifically about the events and serving different populations, smaller distribution points, we're more than willing to help you tell that story today. We appreciate you being here for that. So with that, I will turn the microphone over to our Executive Director, Marcy Flanagan, to say a few words about what public health is doing and what we're planning.
Good afternoon. As you can see, we're at Fillmore Gardens Senior Housing Center, offered by the City of Phoenix as a pod location. This is one example of how we are shifting our focus to bringing vaccine to those who need it most and who may not be able to get vaccinated at one of the larger pod sites. As we've said all along, the pods or point of dispensing sites were never meant to be our entire vaccine strategy. They were intended for phase 1A and worked well enough that we extended them into the early stages of 1B, and we are now focusing on community-centered events. All of our partners are critical to making these vaccine efforts successful. We have been expanding our efforts to bringing vaccine to where people are. This helps address barriers such as transportation, internet access, and others, which also opens up online appointments at the other larger pod sites for those that can access them more easily. We have been partnering with school districts and pharmacies to provide vaccine to teachers, school staff, and childcare workers. We have had 27 of those events so far, with over 41,000 doses administered. We have also had 14 events at senior housing centers just like this one. These events have been across the valley, from Mesa to Guadalupe to Tullison to Wickenburg, and many more communities across Maricopa County. We are grateful for our partners like the University of Arizona, who has provided volunteers who are administering the vaccine. We know that there are questions about eligibility yesterday about how to move forward with prioritization. We are working out how to ensure that people who are at the highest risk, either by age or occupation, are able to get vaccine in Maricopa County as supply allows. Thank you, and I'm going to turn it back over to Fields.
All right, thank you so much, Director Flanagan. A brief introduction here. I already said he was going to be speaking, but Jorge Mendoza Yascasi is the Consul General for Mexico based here in Phoenix.
Thank you very much, everyone. I will say some words in Spanish for the Hispanic media. Bueno, gracias por estar aquí, gracias por la invitación. Quiero agradecer a las autoridades de salud del condado de Maricopa, a su vocera, Joana Molina, también muy especialmente a la Universidad de Arizona, a la doctora Cecilia Rosales, que encabeza el proyecto también. Y bueno, para el Consulado de México es muy importante el esfuerzo que se está haciendo en conjunto para lograr hacer llegar esta información a minorías, sobre todo, bueno, pues a las minorías afroamericana y obviamente mexicana hispana. Hemos tenido un cierto rezago, hay que reconocerlo, en cuanto al acceso a la vacuna. Nosotros en el consulado nos estamos aliando con las autoridades del condado, con la Universidad de Arizona para poder hacer llegar este tipo de información, poder ayudar a estas personas que carecen de recursos esenciales para poder registrarse, sobre todo, que les llegue esta información y que se registren y tengan acceso a la vacuna y poder abatir este rezago que actualmente estamos enfrentando. Es muy importante este evento. Estamos en una comunidad que ha tenido cierto rezago en este acceso a la vacuna y bueno, pues la idea es trabajar en conjunto. Nosotros en el consulado tenemos un programa que hemos denominado Puerta a Puerta. Tenemos acceso, contacto, enlaces comunitarios en varias de estas áreas un poco marginadas y bueno, vamos a poner a disposición de las autoridades de salud del condado y también de la Universidad de Arizona toda esta información y todo este alcance comunitario que hemos logrado a lo largo de casi ya 2 años de trabajo para poder llegar a hacer esta información muy importante. La pandemia, el COVID-19, no distingue origen étnico, no distingue estatus migratorio, no distingue nada. Todos estamos expuestos y por lo tanto todos debemos de recibir la vacuna. Muchas gracias por su atención.
Thank you so much, Mr. Mendoza. Yes, Gus. So at this point, we'll take questions, and as I said, we might be a little rusty taking them in person here, so we'll figure that out. So please raise your hand if you have a question, and we'll get started here. Start with the gentleman in the middle. Who's paying for this event? Okay, so so the transportation of the whole operation is what you're asking. Okay, so I believe the financials are being covered by the CARES Act money that was given by the federal government to Maricopa County. But Director Flanagan, do you have any more to add to that? Okay, we'll have Director Flanagan come up and answer your question more completely.
So the vaccine that is provided to Arizona, all the vaccine is free from the federal government. The partnerships we have with the partners, the cost that it takes them to come and do these events, we're paying for with federal funds that we were allocated to do these types of events. And then those partners also rely on a lot of volunteers to make these successful and make them happen.
And with that, how many people are you guys expecting to impact?
At just this event or in general? So we don't have a general number for that. What we're doing is really targeting zip codes and areas that are underserved in the community. And we base it on what those zip codes populations are and how we can get our partners there and to work within those zip codes. So there's not a specific number in mind.
Do you have, while you're there, hang on 2 seconds. So we want to be able to have Joanna translate into Spanish real quick. So let's just kind of keep it in a orderly fashion so she can do it. She can't come up here and just repeat it all and remember it all. So Joanna, will you come up, please?
La pregunta es que si quién está pagando por este evento. Bueno, el gobierno federal, a través de los fondos de CARES Act, es como se está pagando este evento. Y también la vacuna es gratis, proveniente del gobierno federal. El costo del resto de los eventos son con fondos federales y además con agencias socias y que tienen voluntarios que pueden hacer. Estamos llegando a códigos postales donde sabemos que la comunidad es más vulnerable y esa es la misión de este tipo de proyectos.
All right, thank you so much for the question. And I believe it was Foxen, you had a question, follow-up?
Just curious, do you have a certain number of these planned, or is it more of just kind of, as she said, just kind of bouncing around where the need is, and I guess, where do we go from here, I guess?
Well, it's far more strategic than just bouncing around, but certainly as we've gotten more and more data that's come into the zip code data that you can see on our website, it's given areas of focus and clarity as to where people have not gotten the vaccine yet. Let me have Director Flanagan come up and expand on that a little bit more, because certainly I wouldn't want it to seem random. We are certainly targeting places where we know people live, like here. We know people live here, and these are folks that might not have transportation or the ability to get out to one of those large pods. So Director Flanagan can answer that a little more thoroughly.
Sure. So we have a lot of these events planned, but right now, as you're hearing consistently around the state, our biggest limiting factor is the amount of vaccine we're receiving in Arizona. So as the vaccine increases, you're going to see more and more of these events. Who we're prioritizing at those events are really, in these community sites, are people that are underserved, individuals of color, and those that have a hard time with transportation or getting to a general pod. And those are determined by lots of data we have, including census data, local data, all in our zip code map. And as more vaccine becomes available, you'll see more of those pop up. The way we're prioritizing is really based on the parameters that have been sent so far. Older populations for now, as the vaccine rolls out and as the state guidelines have more age groups included, we'll have more age groups included in our community sites that we hold.
La pregunta entonces, ¿están planeados? ¿De dónde vamos de aquí? ¿Cómo se escoge el área? Bueno, son áreas específicas, específicamente para personas que no tienen acceso a la transportación, que no tienen acceso al Internet. Como ustedes saben, tenemos lo que viene siendo limitada la cantidad de vacunas que tenemos en el condado Maricopa. Y eso, cuando tengamos más vacuna, tendremos otros grupos de prioridad a los que podemos alcanzar, entre ellos comunidades que son de color, personas que no tienen transportación, acceso al Internet. ¿Cómo se escogen esos sitios? Es a través de los datos que tenemos del censo y también con la dirección que tengamos del Estado, en este caso para las personas mayores. Ya como más grupos se agreguen, podemos agregar a más personas también que puedan calificar para la vacuna.
All right, I know a lot of people, I know there are a lot of questions. Let's start over here. Okay.
You're part of the meeting yesterday where they unanimously decided to offer the vaccine to 55 and up. Why was that decision made and why was the plan changed?
So why was the plan changed to go to this hybrid model, by VAPAC? Okay. And 55 and up specifically in the VAPAC choices.
So the question is about how the decision was made with the VAPAC committee to change to a hybrid approach. A lot of data was provided by ADHS that was very informative about the decision for VAPAC. You've seen some states that have moved to straight and age-based priority. What we did in Arizona was a hybrid. So we are continuing to target those frontline essential workers at the county level with the vaccine we receive. And then statewide, they're going with the age-based approach. Some of the data that was really helpful in making that determination was that 65% of individuals with chronic medical conditions are 65 and older. And when you include 45 and over, that's over 80% of individuals in Arizona. And so it was easy to know that by going by age, we were able to really capture those at highest risk for hospitalization and death. And that's why that decision was made. But remember, it's also a hybrid strategy. We're also working with our employers of frontline essential workers to get vaccine out to those individuals as quickly as possible.
Y la pregunta es, ¿por qué se escogió, cómo se cambió la prioridad ahora para llegar a las personas de 55 años o mayores? Bueno, como ustedes saben, ayer el Estado dio a conocer un tipo de guía. Nosotros hemos cambiado al método híbrido, que son diferentes a algunos estados. Aquí en el condado vamos a hacer el método híbrido para incluir a grupos esenciales. 65% de las personas que sabemos nosotros aquí tienen condiciones médicas crónicas y sabemos precisamente que entre más mayores sean, más complicadas pueden ser la situación y el riesgo de morir es mucho mayor. Por eso hemos entrado al grupo, a lo que viene siendo un método híbrido. También trabajaremos con empleadores para que puedan vacunar a los trabajadores esenciales.
All right. Good question. Thank you. Mike, we'll go here and we'll start working our way back through, okay?
Yeah, just talk about underserved communities, and we know that this is like a one facility, right? But we know community at large, 85009, that zip code, a glaring example of a lot of these zip codes in the west part of Phoenix. Often folks who are eligible to get the vaccine, they're getting vaccinated at much lower rates than other parts of the county, oftentimes the more affluent parts of the county. So what is kind of the strategy in the weeks ahead to try to outreach to some of these communities and try to improve on some of them?
Sure. So the question is, what's the plan to reach underserved populations, specifically going back to that zip code question? You know, we know zip codes based on the data. Some have received very little vaccine compared to the eligible population. So Director Flanagan can address that.
I'll address a little bit broader sense of what we're doing and then also talk specifically about 85009, what we're doing in that community. So a lot of this work we're doing in these communities are working with the leaders, whether that's faith-based leaders or individuals that are well known in those communities, and working with them on what is the best approach to get vaccine to those individuals living in those areas. Specifically, when you look at 85009, the Mario Diaz and Associates has done a lot of work. They've actually done yard signs and education campaigns about the vaccine, and we are working with that agency. They are holding a vaccine door-to-door initiative where they're actually providing transportation to individuals in that zip code to one of the state-run pods. We also have an event in a couple weeks that's a county initiative that'll be in the 85007 zip code, but we're targeting all those surrounding zip codes for individuals to come and receive vaccine at those as well.
Y la pregunta es, ¿qué pasa con las comunidades que no tienen acceso a programas de vacunación, específicamente hablando del código postal 85009 o áreas del oeste de Phoenix, que sabemos que mucha gente es vacunada con menos posibilidad de tener esta vacunación? Bueno, es mucho el trabajo que se hace a diferentes autoridades y parte de eso es trabajar con asociaciones, con grupos, incluyendo líderes comunitarios, para poder identificar esas áreas que pudieran no tener acceso a lo que viene siendo la vacuna. Estamos trabajando con una organización y compañías como la de Mario Díaz para saber en donde está haciendo una campaña de ir puerta a puerta precisamente y llevar transportación a las personas que no tengan acceso a la transportación y poder vacunarlos. También estamos haciendo en el condado de Maricopa un programa piloto en el código postal 85007, que es del condado, un programa para llevar la vacuna a esas áreas que tienen más vulnerables y que tienen menos acceso a la vacuna.
Mike, thanks so much for the question. Do you have a question still?
Yeah, it was just a follow-up question. Some of the Hispanic people that I have interviewed, they still work, so they don't have those flexible times. Are they planning on doing this kind of events where it will be open to those people within the community, or maybe do them later, where people can have access to these services?
Sure. So having maybe it's the weekends, the evenings, early mornings, whatever it might be, not 9 to 5 necessarily. Is that what you're asking?
Yes.
Okay. Director Flanagan will take that. But I know we have already done some events. In fact, I saw on ABC 15 this weekend, we were doing an event at a particular facility. So I know we've been doing those.
Yeah, thank you for that follow-up question. It's a very important point that we know as we get into these communities, we have to be flexible and come to the individuals of where they are and what is most meaningful to them. So we absolutely will be having non-traditional hours of operation at some of these sites. And also I'd be remiss not to mention our city partners. City of Phoenix, City of Mesa have been really great in helping us identify communities and also provide staff and support for all of these events.
Y la pregunta es, ¿qué sucede con la comunidad latina o hispanos que trabajan quizás durante el día y no tienen acceso a este tipo de eventos durante el día? ¿Cómo pueden ellos también ser vacunados? Bueno, sabemos que tenemos que ser flexibles y en el condado de Maricopa trabajamos muy de la mano con diferentes agencias para poder ir y servir a esas comunidades en diferentes áreas. Podemos mencionar a la ciudad de Phoenix, a la ciudad de Mesa, que estamos tratando de identificar ciertas áreas para poder llevar la vacuna a diferentes horarios, los fines de semana o de día o de noche.
All right, great question. All right, right in the middle here.
In these communities, especially in 1A, 1B, those people to get vaccinated, sometimes they have a lot of family members living in one household. And does this vaccine, them getting vaccinated, also the people that live there get vaccinated as well?
Okay, so you're asking about priority 1A and 1B, and people that are living perhaps in multi-generational households or households with multi-family members, and perhaps an extra family. I mean, there might be extra family members in there too. And whether or not the eligibility changes based on those living conditions, right? So right now we're really focused on the priorities. Dr. Sonnenschein will come up here and talk a little bit more about those situations and how we'll make adjustments moving forward.
So to address your question about multi-generational households, we did initially start with those in phase 1A and 1B prioritized because they were both the most at risk of being exposed and the most likely to get ill. So what our strategy now, as Dr. Flanagan said earlier, is we're really focusing on the people who are older because they're most likely to be hospitalized or die from the disease. When people live in multi-generational households, it's important that people who are not yet vaccinated continue to wear their masks and wash their hands and stay away from those who are most vulnerable when they're ill. But as we go down in the age groups, as was said earlier, the vast majority of people who have chronic conditions and who are most likely to be hospitalized or have severe illness are actually in that 55 and older age group. And then as we get to the 45 and older, it will cover almost everyone with chronic illness. So that's really our strategy, along with, at the same time, vaccinating those who are exposed most often at their work site and are unable to telework. So people who have to work in person every day to give us the food that we need and the services that we need, and we want to make sure that they're protected. So not only are they protecting themselves, but also their families, as you mentioned. Thank you.
Y la pregunta es, ¿qué sucede para las personas que están en la fase 1A o 1B, que tienen familia, que viven en un ambiente multigeneracional y que podrán recibir quizás las otras familias la vacuna, si no están dentro del grupo de la edad que califica? Bueno, inicialmente la vacunación en la 1A y en la 1B específicamente para los grupos de más alto riesgo, por eso se seleccionaron a esos grupos. Y ahora nos estamos enfocando en los adultos que tienen algunas condiciones crónicas que son de más alto riesgo, adultos mayores, y también para los que no se puedan vacunar aún, seguir utilizando la mascarilla. El lavado de manos es muy importante. Ahora que hemos entrado a la fase de los 55 años o mayores, también es una de las estrategias para seguir alcanzando a la gente que tenga alguna condición crónica y que también están expuestos a las personas que pueden ser de más alto riesgo. También ahora para vacunar a los trabajadores esenciales, específicamente los que trabajan enfrente en las trincheras, como se podría decir, para brindar los servicios que necesitamos.
All right, great question. Please, KTAR.
If we could just clarify, so who exactly is Maricopa County vaccinating? And then can we also talk about long-term care facilities? Have we reached those in the county?
Yeah, so who are we actually vaccinating? I mean, who are we prioritizing right now? And did that shift with yesterday's announcement?
Correct.
Okay, and then where are we at on our long-term care facility program? I think we've explained at previous press conference, we're not in charge of every long-term care facility. There's a federal program as well, and the states of long-term care facilities that public health has been working through, and they've made a lot of progress. So I think Marcy will come up and talk a little bit more about that.
So right now in Maricopa County, if you go to a retail pharmacy location or any of those state pods that are operating, if you are 55 and older, you will be eligible to be vaccinated in Maricopa County. For the county, with the doses we receive directly allocated to Maricopa County, we have a few initiatives going on. One of them is those long-term care facilities that did not sign up with the federal program. Almost all of them have received their first round of vaccines, and we need to go back in for that follow-up. We're also reaching out. There's a few that didn't sign up for our program or the federal program, so we're trying to make contact with them and make sure they are part of an initiative if they want to be. All first and second doses will be completed in long-term care facilities by the end of April. As far as the other communities that we're targeting, we will, with our Johnson, when it arrives as early as next week, we are working with those frontline essential worker employer groups and getting vaccine to them. And so that's the other. And then the third arm of what we're focusing on here in Maricopa County are the for hard to reach populations. And that's going to be using the vaccine we'll be using is Johnson & Johnson and Pfizer for all of our county initiatives.
Y la pregunta es, ¿a quién se está vacunando entonces aquí en el condado de Maricopa? ¿Quiénes son los grupos de prioridad? ¿Y qué ha pasado con las instalaciones a largo plazo? ¿En dónde estamos en ese proyecto? Bueno, el condado de Maricopa, ustedes saben que pueden acudir a alguna farmacia, pueden también ir a los puntos de distribución, tanto del estado como del condado, y recibir la vacuna. Tenemos varios proyectos que están siendo en este momento, que ya arrancaron, incluyendo las instalaciones a largo plazo, aquellas que no son parte del programa federal de vacunación. Salud Pública del condado de Maricopa las está vacunando, han recibido la primera y la segunda dosis se espera que termine para finales de abril. También ahora con la vacuna de Johnson Johnson, que se espere que llegue la semana que entra, se vacunará a los trabajadores esenciales. Estamos trabajando con agencias que cuentan con empleados para poder realizar este proyecto. También otros eventos como estos, que son eventos especializados para comunidades vulnerables.
And Director Flanagan wanted me to remind everybody of another. It's more of a, instead of a three-legged stool, it's more of a four-legged whenever you talk about the approach we've had. But the schools, workers, as well as educators, has been a huge part of this operation from the very beginning, using the Moderna vaccine. Crossed the mark of 54,000, almost 55,000 doses administered in phase 1A and phase 1B, which includes that group. So those school events that are kind of a larger version of these events, but they're closed events, reaching thousands of people, that will wrap up probably by the end of this month, beginning of April. So that's been a big part of our efforts as well. Go ahead.
I just expand on the Johnson & Johnson. How important is that? And just kind of, do you have a plan on kind of, will that go into more of these type of facilities, or is it just, you just give what you're taking, or given, take what you're given, I guess?
Sure. If you look on our website, and Dr. Sonnenschein can talk a little bit more about the vaccine, I'll just mention real quickly on the website, the public health page about vaccination. When you look at this list of events, or you look at the list of pharmacies and how to get an appointment, that sort of thing, it tells you what vaccine they're using. And now Johnson & Johnson will kind of work into the operation. But Dr. Sonnenschein can expand on that.
And also just the ease, just the one shot versus the two and things like that. I mean, just
Absolutely. And that's a question that everybody's asking. Which is the best vaccine to take? And the answer to that question really is whatever vaccine is available to you is the best vaccine for you. So all of the vaccines were tested in slightly different ways in different countries with different strains. And they also used different outcome measures to measure effectiveness. But the one thing that all of the trials agree on with all three vaccines is that they are 100% effective in reducing in preventing hospitalization and death. So since all three are 100% effective in preventing hospitalization and death, they are all very good vaccines. The reason why we are using the Johnson & Johnson vaccine for particular populations is because of what you just mentioned, that it only requires one dose. So it's really ideal for populations that you may not be able to get to twice, or they may not be able to get to us twice. So we're using it to get to those essential workers, where logistically it's going to be challenging to get to them twice, and in other situations where people might be more transient. Thanks.
Bueno, la pregunta es que la vacuna de Johnson Johnson que se va a ofrecer, ¿cuál es la que se recomienda? ¿No? ¿Qué le dice al público? Bueno, en estos eventos cabe mencionar que la vacuna que tengan ustedes disponible es la que se recomienda que se ponga. La mayoría de las vacunas en este caso han sido ya recibido las pruebas adecuadas para darse cuenta que pueden prevenir precisamente la hospitalización y un gran porcentaje de enfermedad. También la razón por la que se utiliza la vacuna Johnson Johnson para los trabajadores esenciales y en comunidades vulnerables es precisamente por eso, porque solamente requiere una dosis y es más fácil alcanzar a esas comunidades en una sola ocasión que ir varias veces a un mismo sitio a vacunar a tanta persona.
So Mike, I know you have a question. Let me go down this side and I'll come back to you. Anything here real quick? Do you have anything?
Yes.
Okay.
When we listened to Council of Mexico, he was mentioning that most of the time you see like Hispanic community is less the population that is going to take the vaccine most of the cases. Do you guys know if
Okay. So are we seeing members of the Hispanic community coming to our events that we hold in those primarily Hispanic communities? And do we think there's a language barrier, or what might be preventing people from getting the vaccine? Um, I know Joanna has some thoughts on that probably. And do you want your answer in Spanish primarily? We can answer in both. Okay. We do know there's some hesitancy, and actually, do you mind coming up for a second and talking a little bit about what your experience is with people that have reached out to your office? Okay.
That was a question. What my experience is.
So the question is there a language barrier? Is that preventing people from getting it? And are we seeing people come to these events from
Yes.
the Hispanic community?
Yes. Bueno, voy a decir en español y luego tú me traduces. Sí. Sí definitivamente hay una barrera en el idioma. Hay mucha gente, sobre todo de la tercera edad, mayores de 65, que manejan poco el inglés. En ese sentido es que el consulado, y bueno, pues con el gran apoyo obviamente y gran trabajo del condado, de las autoridades de salud, estamos llevando esa información en español, a través de los medios en español con los que tenemos acceso, y pues a través también de nuestras redes sociales y también a través de nuestros enlaces comunitarios.
So what we're doing is we're partnering with different communities to make sure that we can get our messages out clearly and accurately in a variety of different languages and culturally appropriate messages. We know in general that people of color and minorities are somewhat hesitant to get the vaccine, and often that's because they may not have access to accurate information. So our goal in working with the Mexican consulate and and other consulates, as well as faith-based communities and the refugee community, is to make sure that we're meeting the people where they're at and that the messages are in the language that they understand and are culturally appropriate, so they have the most accurate information to base their decisions on.
La pregunta era que si hay algunas barreras precisamente en la comunidad hispana y qué se está haciendo para que ellos puedan llegar a estos puntos de distribución del condado Maricopa. Bueno, esa es una de las situaciones por las que nosotros estamos trabajando muy de la mano con diferentes socios. Estamos incluyendo a los consulados, tanto de México como de Guatemala, a los grupos de fe, para iniciar ese tipo de programas en la comunidad y que ellos puedan también darnos información de lo que escuchan en su comunidad, que la gente tenga acceso a la vacuna.
So we were playing dueling subject matter experts over on the other side. So did that answer your questions? All right, excellent. You have one question before I go back to the other end?
Yeah, just when you're kind of offering more vaccine, when's kind of like the next phase of the rollout going to start? Do you anticipate?
Okay, so when can we offer more vaccine? I think we've been saying for weeks, and everyone's really familiar with. I sound like a broken record sometimes. We'll offer more vaccine when we have it, right? And we do know that we're getting, hopefully by next week, that will add to how much we have. And Moderna and Johnson & Johnson are part of this strategy and use. So, sure. Like when can we expand operations? I think I don't know if we have. Do we have a solid date? Okay. Dr. Sonnenschein will talk a little bit more about that. Forgive me. It's Director Flanagan.
It certainly would be helpful if we all had dates and timelines of how much vaccine was coming to Arizona. It would give us a lot clearer picture of when we can expect to move into the different phases. What we're using as trigger points is really to say when we reach between 55 and 60% of the target population will expand. So when we had already reached over 55% of individuals 65 and older, that's why the trigger to move to 55 was put into place. When we meet that 55 and older, when we see over 55% of that population, we'll move down to 45 and younger. So those are the triggers we're looking for. And the same goes for those essential workers. We're trying to give and sort of divvy up the Johnson & Johnson that comes among several of those work occupations that are identified by the CDC ACIP for being at highest risk. And again, that'll just continue as more vaccine comes. We'll be able to continue to increase how many individuals are receiving that vaccine.
Y la pregunta es, ¿cuándo se ofrecerá más vacuna o cuándo se expandirá a otros grupos, a otras fases? Bueno, lo que sabemos es que el 55%, 60% de la población, cuando ya sea vacunada en las fases que tenemos ahorita, podemos agregar nuevos grupos. Sabemos que el 55% de las personas de 65 años o mayores ya se ha vacunado, por eso hemos arrancado ahora para las personas de 55 años en adelante puedan vacunarse. Una vez que llegue la vacuna de Johnson & Johnson, dividiremos también a los nuevos grupos que hemos agregado para que puedan recibir esta vacuna.
All right. So, Mike, we took care of your question then? All right. All right. One more question, and then it's getting a little warm out here. So go ahead, please.
How successful has the coverage been in underserved communities, and how are you tracking that?
So how are we tracking our successes in underserved communities, and how are we tracking and how are we measuring success? Okay. Dr. Sonnenschein will talk a little bit more about that.
So on our website, we have a vaccine delivery map. And what we're doing is we're looking at the populations who are eligible to receive vaccine to make sure that we're counting everyone who is eligible who has gotten vaccinated. So that's generally how we're looking at the map overall. And then we're identifying particular areas that have less vaccination coverage. And that often does correlate with those more vulnerable populations. So individuals who may not have transportation, who may have lower socioeconomic status, who may have less flexibility in getting vaccinated outside of work hours. So what we're doing is we're looking at that map, we're identifying areas, and we're also looking at census data and information about socioeconomic status. We're finding the leadership in that community to make sure that we can get to the people who are most vulnerable, and then scheduling events and making sure that the information for the events is publicized and language appropriate and culturally appropriate.
Y la pregunta es, ¿cómo se mide el éxito de los programas de vacunación? Bueno, tenemos un mapa del área de vacunación en el condado Maricopa. Cuando vemos ese mapa podemos ver qué poblaciones en el condado se han vacunado y qué áreas todavía pueden mejorarse, identificar esas áreas que no tienen tanto acceso a la vacunación. Eso quiere decir también que pueden ser por falta de transportación, por falta de tener acceso al internet o también una computadora. Por esa razón, trabajamos con diferentes grupos para que puedan tener acceso a la información en sus propios idiomas, también en las redes sociales, que sea culturalmente de esta información en su propio idioma.
All right, great questions. I'd like to thank everybody and receive a resident. I believe we have a couple of residents we can make available for you if you want to interview somebody who received the shot today and lives here at the facility and can talk a little bit more about this event. Also, of course, we have our partners with University of Arizona. They're here as well. This isn't the only event they're running. They've been a great partner and they've run other events. And the City of Phoenix, of course. Thank you for the reminder. This is a City of Phoenix facility, and as was said earlier, Mesa, City of Phoenix have been great partners as well. These are very large cities, and they really know their populations. Up at the county, we're kind of working at the 35,000 foot level, so it's important to work with the cities that know their residents.
Is there any thought of, going to the Tucson community or Yuma? These communities are also really lower
Sure. So that's really not the responsibility of Maricopa County. Obviously, Pima County and Tucson are probably working together down there. I don't want to speak for them. Yuma County and Yuma City would also they would have their own operations, but they have a similar structure where the vaccine is coming from the state level, and we're all working together on a short vaccine supply at this point. So it's how do you distribute it, and how do you come up with the best plan that serves your community the best. So again, I don't want to speak for them, but I'm sure they're coming up with these same questions at the same time. So thank you, everybody. Thanks to those on Facebook and YouTube. Of course, we'll let you know when the next event is. Thank you.